welcome to The Acorn, the podcast that drops a little bit of psychoeducation so you can gain a better understanding of the therapy world and yourself. So without further ado, let's jump into our episode. Hello and welcome to Season 1, Episode 16 of The Acorn. This is our final podcast episode of this season, and I wanted you to know that I really enjoyed sharing these little tidbits of psychoeducation with you. As I reflected on what I wanted to share in this episode, I realized that I wanted to leave you with a little helpful resource that I like a lot. So today, I'll be sharing with you a guided meditation called A Compassionate Hand. This was adapted from The Reality Slap by the amazing Dr. Russ Harris. The music I will play under this meditation will be using bilateral stimulation, which will activate both hemispheres of your brain. So be sure to put on headphones or pop in your earbuds so that you can optimize the experience. So without further ado, let's begin. I invite you to find a comfortable position in which you are feeling centered and alert. If you're seated in a chair, you can lean slightly forward, straighten your back, drop your shoulders, and press your feet gently onto the floor. Now bring to mind a current significant challenge. This might be something that's happening that you don't feel like you have the skills to handle, or maybe it's that you find yourself frequently impatient, dealing with ongoing criticism, or maybe you're struggling to communicate your thoughts or feelings. Bring that to mind. Take a few moments to reflect on the nature of this challenge, to remember what happened, to consider how it's affecting you, and to think about how it might impact your future. Pause. Reflect. Notice what difficult thoughts or feelings arise. Now pick one of your hands and imagine it's the hand of someone very kind and caring. Place this hand slowly and gently on whichever part of your body experiences the most pain. Perhaps you feel the pain more in your chest, or perhaps in your head, neck, or stomach. Wherever it is most intense, lay your hand there. And if you're feeling numb, lay your hand on the part that feels the most numb. If you're feeling neither pain nor numbness, then simply rest your hand on the center of your chest. Allow your hand to rest on you, lightly and gently. Feel it against your skin or against your clothes, and feel the warmth flowing from your palm into your body. Now imagine your body softening around this pain or discomfort, loosening up, softening up, and making space. If you're feeling numb, then loosen and soften around that feeling of numbness. And if you're not feeling pain or experiencing numbness, then imagine in any way you like that in some magical sense, your heart is unfurling and opening up. Now I want you to hold your pain or numbness very gently. Hold it as if it is a crying baby, or a whimpering puppy, or a priceless work of art. Infuse this gentle action with caring and warmth, as if you are reaching out to someone you really care about. Let the kindness flow from your fingers into your body. Now use both of your hands in one kind gesture. Place your hand on your chest and the other on your stomach. Breathe deeply and let them gently rest there, and hold yourself kindly. Take as long as you wish to sit in this manner, connecting with yourself, caring for yourself, and contributing comfort and support to you. We've come to the end of the guided meditation, but I'll let the music play a little longer. You can sit like this for as long or as little as you wish. 5 seconds or 5 minutes. The duration does not matter. Just sit with one hand on your chest and the other on your stomach and receive loving kindness. Receive self-compassion for the next few moments. And remember to pause, breathe, hope, and heal. Take care. Well, this has been another episode of The Acorn. Remember, the content in these podcast episodes are for educational, informational, and entertainment purposes only. Disclaimer: anything said in this podcast should not be considered as treatment, professional consultation, advice, clinical instruction or assessment, or any other mental health replacement. Listening to this podcast does not create a therapist-client relationship between you and the podcast host. Always seek the advice of your own mental health provider regarding any questions or concerns you may have about your mental health needs. Also, if you need immediate help, contact your mental health provider or call 911. Take care.